Hello students, this is Dr. Shobhana, Assistant Professor from the Department of Conservative Dentistry and Endodontics. In today's session, we'll be discussing about introduction, history, composition, classification, setting reaction, advantages, disadvantages, indications and contraindications of dental amalgam. Dental amalgam has been a cornerstone material in restorative dentistry for over a century. Known for its durability and affordability, it remains widely used despite advancements in newer materials. Some believe that the word amalgam comes from the Latin word amalgama, while some say that it comes from the Greek word malgama. Now let's see the definition of dental amalgam. It's a silver-colored restorative material made by mixing liquid mercury with a powdered alloy of metals like silver, tin and copper, which may also contain palladium, zinc and other elements to improve handling characteristics and clinical performance. To understand why dental amalgam remains relevant today, let's take a look at its journey through history. From its origin in ancient China to its modernization in the 19th century, dental amalgam has stood the test of time. In the year 1819, Joseph Bell introduced silver amalgam and he termed it as Bell's putty. This was an accidental invention by Joseph Bell. He mixed mercury with silver fillings and found the mix initially had a putty-like consistency which later hardened like metal. Later in the year 1833, Crocker Brothers introduced silver amalgam in North America and named it as Royal Mineral Succedaneum as a substitute for gold for the royal family. In the year 1845, the American Society of Dental Surgeons raised a concern about dental amalgam and considered it as toxic, thereby igniting the first amalgam war. The society went further and requested members to sign a pledge refusing to use amalgam. This lasted for 5 years. Later in the year 1926, Alfred Stock started the second amalgam war. He claimed to have evidence showing that mercury could be absorbed from dental amalgam, which leads to serious health problems. Later, a committee in Berlin investigated the allegations of amalgam toxicity and came to a conclusion that there was no reason to stop dental amalgam. In 1930, amalgam was given the ADA specification number 1. In 1980, Hall Huggins from Colorado started the third amalgam war. He was convinced that mercury released from dental amalgam was responsible for human diseases affecting the cardiovascular system and nervous system. And again, this claim was refuted by the release of research studies in the media affirming that amalgam is safe for use. Now let's move on to the classification of dental amalgam. Dental amalgam can be classified in various ways. The first classification is based on the main constituent. So amalgam can be classified as copper amalgam, silver amalgam, pre-amalgamated alloys, amalgam with noble metals. The second classification is based on the number of alloy metals present in amalgam. So first is binary, ternary and quaternary. Binary has 2 metals in it, so that is silver and tin, while ternary has 3 metals in it, which are silver, tin and copper. Quaternary has 4 metals in it, which are silver, tin, copper and indium. The third classification is based on whether the powder contains unmixed or admixed alloys, which are admixed or dispersion or blended alloys. Next is single compositional or unicompositional alloys. The fourth classification is based on powder's particle size. which are microcut, fine cut, coarse cut. Next classification is based on the copper content, which are low copper content alloy and high copper content alloy. Low copper content alloy contains less than 6% of copper, while high copper has 6 to 30% of copper. The next classification is based on the shape of the powdered particles, which are spherical shape, lathe cut shape, and a combination of spherical and lathe cut. The next classification is based on which noble metals are present in amalgam, whether it is platinum, gold, or palladium. The last classification is based on the presence of zinc, which are zinc containing and non-zinc containing. Zinc containing, if the amalgam is zinc containing, it should contain zinc more than 0.01%. If it is non-zinc containing, it should contain zinc less than 0.01%. Now let's move on to the composition of dental amalgam. As we discussed before, amalgam is a blend of silver alloy powder and mercury. And now let's delve deeper into what the silver alloy powder consists of and the role of its individual components. The first component of silver alloy powder is silver, which forms the major component of dental amalgam. Silver whitens the alloy. It gives strength to the dental amalgam. It increases the flow and creep and increases the resistance to tarnish. The second component is tin, which controls the rate of reaction. It reduces the setting expansion. It decreases the strength, reduces the resistance to tarnish and corrosion, and it forms the weakest phase. The third component of dental amalgam, the third component of silver alloy powder is copper, which hardens and gives strength to the dental amalgam. It decreases the flow and increases the setting expansion. The fourth component of dental amalgam is zinc, which acts as a reducing or deoxidizing agent. That means it acts as a scavenger for oxides. The next function of zinc is it reduces the marginal failure. And the most important property of zinc is that it causes delayed expansion. The fifth component is noble metals, which are platinum, palladium, and indium. Platinum and palladium hardens the alloy and increases the resistance to corrosion, while indium and platinum increases the plasticity and resistance to deformation. Mercury forms the liquid component for dental amalgam and activates the reaction along with silver alloy powder. Among the alloy particle, silver alloy requires less mercury to wet, while admixed alloy requires more mercury to wet the powder particles. Lathe cut particles are very difficult to wet with mercury. Now let's see what is an amalgamation reaction. Amalgamation is the process of reaction and setting when mercury is amalgamated or triturated with silver alloy. During trituration, the mercury diffuses into the alloy powder particles, forming various compounds, which are beta phase, denoted by AgSN, gamma phase, which is denoted by Ag3SN. It is the strongest phase and it doesn't dissolve with mercury. The next phase is gamma 1 phase, which is denoted by Ag2, Ag3, and it is the noblest phase and most resistant to tarnish and corrosion. Next comes the gamma 2 phase, which is denoted by SN8, Hg. It is the weakest phase and it is more prone to corrode. The other phases are epsilon, which are denoted by Cu3SN, eta phase, which is denoted by Cu6SN5. Then comes the silver copper eutectic, which is denoted by the symbol AgCu. Now let's see how exactly these phases are formed in low copper, high copper admixed and unicompositional alloy. The powder component of low copper conventional amalgam alloy contains 63 to 70% of silver, 26 to 28% of tin, 2 to 5% of copper, and 0 to 2% of zinc. These components of alloy powder, when mixed with mercury, forms the gamma 1 phase, gamma 2 phase, and gamma phase. The picture on the right side shows the microstructure or set low amalgam. The set amalgam consists of a core of unreacted gamma alloy particles surrounded by gamma 1 and gamma 2 phase. Next comes the high copper admixed alloy. Admixed alloy is nothing but which contains 2 parts by weight of lathe cut particles and 1 part by weight of spherical silver copper eutectic alloy. It contains 69% of silver, 13% of copper, 17% of tin, and 1% of zinc. These components, when mixed with mercury, reacts in 2 steps. In the first step, gamma 1 phase, gamma 2 phase, and gamma phases are formed. In the next step, the gamma 2 phase reacts with silver copper eutectic to form eta phase, gamma 1 phase, and gamma phase. The microstructure of set high copper admixed amalgam consists of core particles of unreacted gamma phase and unreacted silver copper eutectic, which is surrounded by a halo of eta phase embedded in the matrix of gamma 1 phase. Here the gamma 2 phase is eliminated and replaced by a stronger eta phase. Let's move on to high copper single compositional alloy. In this, each particle in the alloy powder has the same composition. It is available in different types, which are ternary alloy in spherical form and quaternary alloy in spheroidal form. Now let's move on to high copper single compositional alloy. In this, each particle in the alloy powder has same composition. It is available in different types, which are ternary alloy in spherical form and quaternary alloy in spheroidal form. The ternary alloy has 60% of silver, 25% of tin, and 15% of copper, while quaternary alloy has 59% of silver, 13% of copper, 24% of tin, and 4% of indium. The alloy particle components react with mercury to form gamma 1 phase and eta phase, and some amount of unreacted alloy particles are also formed during the reaction. The microstructure of set unicompositional alloy has no or very little gamma 2 phase, and eta crystals are more distinctly formed in unicompositional amalgam than in admixed alloys. Now let's explore the key advantages of silver amalgam, which has made it a widely used restorative material in dentistry, which are: it is easy to manipulate, it is relatively inexpensive, it requires less chairside time, it has high compressive strength, it shows excellent wear resistance, it shows minimal post-operative sensitivity. It is observed that though corrosion and corrosion products are detrimental to a restoration, it is advantageous in amalgam restoration to a certain extent. Since amalgam does not bond to the tooth, the corrosion products seal the amalgam tooth interface. The self-sealing ability of low copper amalgam is better than that of high copper amalgam, as the rate of corrosion is more in low copper amalgam. While silver amalgam has many advantages, it's important to consider its limitations as well, which are: it is non-aesthetic, so it can't be used in anterior region. It shows lack of chemical adhesion to the tooth structure. Next is, it can discolor the tooth structure. It has metallic taste and it also causes mercury toxicity. The next disadvantage of dental amalgam is the susceptibility of the patient to galvanic shock, which occurs when teeth with amalgam restoration comes into contact with teeth having a different metal restorative material. In this situation, the two restorative material act as an anode and cathode, and the saliva serves as an electrolyte. This interaction generates an electric current, leading to galvanic shock. Other disadvantages of amalgam are: that it has the tendency to undergo tarnish and corrosion. Tarnish is the surface discoloration on a metallic surface without any loss of structure. In case of low copper alloys, the gamma phase is responsible for surface tarnish, while in high copper alloy, the copper rich phases eta and silver copper eutectic. While corrosion is the chemical or electrochemical reaction of a metal with its environment and its progressive destruction by formation of corrosive byproducts. Gamma 2 phase is responsible for corrosion in case of low copper amalgam. This phase reacts with oxygen, water and fluoride to form tin oxychloride, and mercury is also released during the reaction. This released mercury then reacts with the unreacted gamma particles and produce additional gamma 1 and gamma 2 phases, resulting in more expansion, which is termed as mercuroscopic expansion. This additional reaction and expansion result in porosity and reduction in strength of the restorative material. Another significant drawback of silver amalgam is its tendency for delayed expansion. This occurs in zinc-containing amalgam, which upon contamination by moisture during manipulation result in formation of zinc oxide and hydrogen gas. This hydrogen gas accumulate within the amalgam, exerting enough pressure to cause the amalgam to expand. This expansion occurs 3 to 5 days after amalgam placement. This type of expansion can reach values greater than 400 mm. There are some complications that may result due to delayed expansion, which are protrusion of the entire restoration out of the cavity. Next is increased microleakage. Third is the restoration might show perforation, pitted surfaces and corrosion. Next complication of delayed expansion is increased flow and creep. It can also cause increased pulpal pain. Such pain may be experienced 10 to 12 days after the insertion of the restoration. To understand where silver amalgam is most effectively used, let's discuss its indications. It can be used in class 1 cavity, class 2 cavity, class 5 cavity. It can also be used for complex amalgam restoration and as a core build-up material. But there are certain situations where its use is not recommended, which are the anterior teeth because of the aesthetics. The next contraindication is that it cannot be used in aesthetically prominent areas of posterior teeth. It cannot be used for incipient or primary fissure caries. It cannot be used in small class 6 restoration. It cannot be used for patients with proven amalgam-induced lichenoid reactions. In conclusion, despite advancements in dental materials, silver amalgam remains a durable, cost-effective and reliable restorative material. So if you remember, silver amalgam was introduced accidentally. So sometimes accidents are good. So that's all for today. See you next time on yet another interesting topic. Thank you.